Hi YouTube, it's Kim here and this is Simplified Medicine. Today's topic is fibroids or leiomyomata. The definition of leiomyomata or fibroids is benign smooth muscle tumor of the uterus or the womb. This is where your baby or your fetus resides in during your pregnancy. The epidemiology of fibroids. So about 40 to 50% of premenopausal women above 35 years old have it. Mostly are African descent, based on statistic research. And pathogenesis, which is how the disease developed, they're based on these two hormones, estrogen and progesterone. Okay, they work in tandem to promote the growth of smooth muscle tumor. So estrogen, it increases the proliferations of the smooth muscle cells. At the same time, progesterone stops the cell death of the proliferated smooth muscle cells, right? Because usually when the cells are divided, a body system produce proteins to restrict that growth to prevent cancer from happening. But without these functions, the cancer proliferates, like in this case. And the sites of cancer are various. It can be, this is the uterus, okay? This is the vagina, the uterus wall, the uterus cavity, and the cervix. So these little black dots, massive dots, are fibroids. They're everywhere, okay? These are the probabilities of which they can be in. So they can be inside the muscles, hence intramural. They can be on the inner lining of the uterus, so that's submucosal, or the outer lining, so subserosal. They can be contained inside a lining, but lying outside the uterus, that's called pedunculated. There's one pedunculated here and one pedunculated there. And if it's near the cervix, it's called the cervical fibroid. So, what symptoms? What are the problems caused to the patients? Majority, about 60%, are asymptomatic. They're fine, they don't even notice it. Okay? 20 to 50% feels heaviness, like a dragging sensation in the vagina as they walk. And that may complicate the problem because that can cause confusion with prolapse because they have the same symptoms. It can increase your abdominal girth, which is your tummy circumference, and it can affect your waterworks, like frequency, going to the toilet to pee more often. And the minority, about 30%, have painful period or heavy period. To investigate the problem, the doctor will perform vaginal exam, perform the blood test, and crucial, perform ultrasound to confirm the diagnosis. The ultrasound will be by the transvaginal ultrasound. It's a probe, goes inside the vagina and have a view around the uterus to find and look at the surrounding structures for fibroids. In terms of treatment, if the fibroid is less than 6 to 8 centimeters or the patient has no symptoms, it is watch and wait. On the other hand, if there are symptoms, you can control it with medications like leuprolide to shrink the fibroids. Worst comes to worst, you can do surgery of the fibroid, so myomectomy or hysteroscopic resections. And that's all for today, explaining about fibroids, also known as leiomyomata. Do not forget to like and subscribe. Thank you very much and see you all next week.